assessment.
So today we're going to test the 12 cranial nerves. The first cranial nerve is going to be olfactory, and that's smell. So I'm going to ask the patient or the athlete to smell something. Can you smell this? Yes. Good. The second cranial nerve is going to be optic, and that's vision. So I'm going to have the athlete or the patient read me a sign or a scoreboard for at a game. So I need a sign, and can you read that sign for me, please?
I have no idea what I'm doing.
Good. The third cranial nerve is going to be pearl, and its pupils equal and reactant to light. So I'm going to get my pen light, and I'm going to have you cover your opposite eye, and I'm going to check if the pupils react. Good. So switch arms. Good. And I'm seeing if the pupils are contracting or dilating. So the fourth cranial nerve is going to be trochlear, and that's, she's going to follow my pen line, and that's down and out. So follow my pen line, but don't move your head. Good. So I did down and out, and I did side to side, but that's another cranial nerve later. The fifth cranial nerve is going to be trigeminal, and that's chewing and face sensation. So I'm going to ask the patient if they feel their face. Can you feel this? Yeah. Good. And can you open your mouth and close? Bite down. Good. And that's chewing. The sixth cranial nerve is going to be abducens, and that's side to side. That's when I did my pen light and I went side to side. I tested that nerve as well. The seventh cranial nerve is going to be face expression and taste. So I'm going to have you ask her to smile, frown, cry, and then taste. So I have a piece of gum, and I'm going to ask the patient if they can taste this. Yes, good. All right, so the eighth cranial nerve is going to be vestibulotrochlear, and that's hearing. So I'm going to stand behind the patient, and I'm going to ask her what side she hears this.
Right. Left. Right. Left.
Good. The ninth cranial nerve is glossopharyngeal, and that's to swallow. So I'm going to ask you to try to swallow. Good. And I can feel, do it again. I can feel, make sure she does it, or I can look. So the 10th cranial nerve is going to be vagus, and that's going to be swallow and speech. So I would ask you, can you tell me what your name is?
Molly.
Good. And then swallowing, I tested that before. And then it's gag too, but we're not going to do that today. And then 11 is accessory, so that's a shoulder shrug. So I'm going to ask her to bring her shoulders up, and then back down, up and down. Good. And I would check if maybe one was rising, one wasn't. And then the last cranial nerve is going to be hypoglossal, which is tongue movement. So I'm going to ask you to lick your lips. Good. And that concludes our 12 cranial nerve assessment.